The COVID-19 pandemic has become a major public health challenge globally, with countries of the world adopting unprecedented infection prevention and control measures to urgently curtail the spread of the virus. Early in the year, vaccines were produced to help fight the virus. According to the World Health Organization, about 1 billion people have been vaccinated globally, with the Delta variant ravaging some countries. In Nigeria, the federal government took its first delivery of COVID-19 vaccines, AstraZeneca, in March 2021. 1st of August, the country received the second batch of 4 million doses of the Moderna COVID-19 from the United States as Nigeria steps up efforts to battle a third wave. While government is intensifying efforts to get its citizenry vaccinated against the deadly virus, there are some people whose attitude towards the vaccine has become a source of worry to government and public health workers. What could be responsible for this behavior? Could it be attributed to lack of enough awareness or a case of blatant self-denial of the efficacy of the vaccine? How can Nigerians be encouraged to take the vaccine? These issues and more will be discussed on Panorama, coming to you live from the Lagos Network Center of the Nigerian Television Authority. I am Adeola Komiakiri. President Muhammadu Buhari will on Thursday confer with security chiefs at the presidential villa, Abuja. A statement by the special advisor to the president on media and publicity, Femi Adesina, says the security forces have in the past weeks taken the battle more robustly to insurgents, bandits, and all other criminals troubling the country, and they are now surrendering in droves. The president will be brought up to speed on developments at the Thursday meeting, while plans to bring a decisive end to the challenge will be formulated. President Buhari has signed the Petroleum Industry Bill 2021 into law, working from home on 5 days quarantine as required by the Presidential Steering Committee on COVID-19 after returning from London on Friday, August 13. The president assented to the bill in his determination to fulfill his constitutional duty. The ceremonial part of the new legislation will be done on Wednesday after his days of mandatory isolation would have been fulfilled. The Petroleum Industry Act provides legal, governance, regulatory, and fiscal framework for the Nigerian petroleum industry, the development of host communities, and related matters. The Senate had passed the bill on July 15, 2021, while the House of Representatives did same on July 16, ending a long wait since early 2000s and notching another high for the Buhari administration. And still on the PIA, the presidential assent of the Petroleum Industry Bill into law by President Muhammadu Buhari has been described as not only a milestone, but the opening up of vistas of opportunity in the Nigerian oil and gas sector. Key players are optimistic that it will change the narrative and make the industry more focused, transparent, and profitable. Lydia Sampson chronicles the PIB journey and the way forward for the industry.
June 2021 marks the end of an era in Nigeria's legislative arm of government. It is the termination of the Petroleum Industry Bill's 18-year parliamentary journey. The bill, conceived during the Olusegun Obasanjo administration in the year 2000, is part of efforts to reform the critical sector behind Nigeria's major foreign exchange earnings. Therefore, the bill, being the longest bill in the Nigerian parliament, evoked skepticism of ever being passed. Expert says the signing into law by the president pertains a vibrant oil and gas sector and more revenue for Nigeria through investment opportunities, which was eluding the country for lack of confidence in the investment terrain and a clear policy framework.
It will create additional infrastructure across petroleum value chain. Critical infrastructure will be developed utilizing the incremental revenue from increased petroleum activities. Greater confidence will be engendered.
The present Nigerian National Petroleum Corporation (NNPC) will be reformed and incorporated as the Nigerian National Petroleum Company Limited as the organization assumes full commercial status.
As the national oil company and also as an industry in this country, that is to produce the quick oil. Quick oil means that we have to monetize every resources that is available today so that we create the resources that will create the future for our country.
Truth to be told, the oil and gas sector remain pivotal to Nigerian economy.
The Petroleum Industry Act provides legal, governance and regulatory and fiscal framework for the Nigerian petroleum industry, the development of host communities and related matters. This, they say, is notching another high for the Buhari administration.
The intention of the law by making NNPC a Kama company is for it to be commercially driven.
They probably should be talking about NNPC being made a viable commercial entity that is allowed to operate in alignment with commercial interests and is not totally at the whims and caprices of those that own it.
The Act empowers the Minister of Petroleum Resources to incorporate the NNPC as a limited liability company 6 months after the commencement of the act. The bill's assent into law is expected to make the Nigerian oil sector more attractive and competitive, as well as strengthen accountability. The petroleum industry stakeholder says the 3% assented to for host communities by the president is a giant step towards social justice for the impoverished host communities. They reiterated that no law is ever perfect or can take care of every human desire all at once. For now, Host Communities Trust Fund and Management will spearhead development of the communities. Impact of the new regime on Nigeria's global competitiveness and capital investment in the sector with focus on enhanced tax incentives as well as sustained frontier exploration.
I want to appreciate the cooperation and partnership between the two arms of government, the legislature and the executive arm. We have been able to really cement the relationship so that we are able to work together seamlessly.
The frontier exploration will be applied to all basins and undertaken simultaneously. Funding of the Nigeria Frontier Basin is through the provision of 30% from the NNPC Limited profit. In Abuja, Lydia Sampson, NTA News.
You're still watching Panorama on the network service of the NTA. Let's take a short break now to stay with us. Let's talk health. The federal government says it remains committed to ensuring that Nigerians have unfettered access to safe and effective COVID-19 vaccines. Secretary to the Government of the Federation and Chairman of the Presidential Steering Committee on COVID-19, Boss Mustafa, stated this while officially flagging off the second phase of COVID-19 vaccination in the country. Olusheye Adeagbo reports.
This second phase of COVID-19 vaccination flag-off signifies that all 36 states of the Federation and the FCT can commence administration of more than 400 million doses of Moderna vaccines, as well as 177,600 doses of Johnson & Johnson vaccines to Nigerians. The Moderna vaccine requires 2 jabs administered at intervals, while that of Johnson & Johnson is a complete single dose.
It is in your personal interest as a Nigerian, when the vaccines are made available, for you to ensure that you get vaccinated as quickly as possible, because very soon you will not be able to travel the world unless you produce an evidence.
Why should I take the vaccine? Because NAFDAC is the only agency in the world that is using track and trace to monitor where each vaccine vial goes.
To ensure a seamless exercise, the Federal Ministry of Health provided this guide for health workers in the field.
It has been prepared for health workers and for the delivery of these vaccines to Nigerians in the most effective way. I want to assure all Nigerians that all brands of the COVID-19 vaccine used in Nigeria has been certified by NAFDAC. They are safe and effective, especially against the Delta variant.
Defeating COVID-19 is a collective responsibility, hence the attraction of various partners to the event.
Again, I would like to assure, on behalf of my colleagues in the media, that we will be there as we've always been in the fight against COVID-19.
There is a good news for Nigerians expecting their second jab of the AstraZeneca vaccine, as the country has received about 700,000 additional doses of the vaccine from the United Kingdom. In Abuja, Olusheye Adiagbo, NTA News.
Latest figures from the Nigeria Center for Disease Control as of the 16th of August 2021 shows that 584 new cases of the coronavirus have been recorded in 15 states of the Federation. A breakdown of the figures shows that Lagos has the highest number of new cases with 201, Rivers 149, the FCT 82, Ondo 73, Ekiti 17, Cross River 13, Oyo 11, Ogun 9, while Delta and Osun have 8 new cases each. Bayelsa and Kaduna have 4 new cases each. Kano and Kwara recorded 2 new cases each, while Sokoto has 1 case. The total confirmed cases now stands at 183,087, while discharged cases stands at 167,310, and sadly 2,223 deaths have been recorded across the country. Now, the 1st of August was another milestone for Nigeria in the fight against COVID-19 with the arrival of the Moderna vaccine. This is an indication that government is determined more than ever to achieve herd immunity and end COVID-19 in the country. But are people ready to be vaccinated? Hengino John Adams tells us more.
The end of June witnessed a drastic decline in the number of new COVID-19 infections in Lagos. With positivity rate of 1 to 1.5%, some Lagos residents thought the end of the dreaded virus has come. But their hopes were dashed when the third wave began in July, recording 7 to 9% positivity rate. The third surge threatens to be more deadly, with the Delta variant spreading fast.
The Delta variant is the fastest and the fittest variant of this coronavirus. It is highly transmissible.
The way out of this disastrous situation, experts have said, is adherence to non-pharmaceutical measures and full vaccination. Lagos remains the epicenter in Nigeria, and only about 1% of the population have been fully vaccinated. This figure is low, and the government is working tirelessly to ensure 60% of the Lagos residents are fully inoculated to achieve herd immunity.
Following the receipt of the first installment of AstraZeneca vaccine from the federal government earlier in the year, Lagos State administered a total of 404,414 first doses and a little over 243,000 for second doses.
We can see the impact of the vaccine on the country like USA. We were here when they were recording hundreds of thousands on daily basis, and they started having reprieve when they were scaling up their vaccination.
Enlightenment campaigns about the importance and safety of the COVID-19 vaccines have been on. Some respondents have this to say.
I just feel I'm not taking it. I've not taken it at all. I won't lie to you. If I have a chance now, I can take it.
Research reveals that majority of COVID-19 cases that have led to fatalities in some parts of the world were unvaccinated persons. This is why medical experts are advocating full vaccination. In Lagos, Hingino John Adams, NTA News.
And now to talk to us more on the coronavirus, the third wave, and of course the vaccination of Nigerians, particularly Lagosians, is Dr. Alero Roberts. She is the second vice chairman of the Association of Public Health Physicians of Nigeria, Lagos State Chapter. Thank you, Doc, for joining us on Panorama.
Thank you very much for having me.
Okay, let's go straight to our questions. What is your view about the fight of coronavirus in Nigeria?
Well, I can speak authoritatively about Lagos. I can't speak authoritatively about Nigeria as a whole. On the Nigerian level, of course, you know, it's being led by the NCDC, the Nigerian Centers for Disease Control, and with the assistance of the Presidential Steering Committee, the PSC, you know, who are handling the logistics and handling the how do I put it, the implementation of the emergency response. So, by and large, that's gone as it has gone. Lagos State is doing a tremendous job, seeing as that we are the epicenter of the infection, and that's not surprising, based on our location, based on our economic position in the country, based on our population, you know, and based on the fact that we have the busiest international airport in the country. So anybody coming in comes into Lagos. And so we've had to mount a really robust, both an emergency response and now a containment response. So we're moving into a situation where we accept that we're probably going to live with this virus for a lot longer than we expected, so we have to have a robust health system that can handle the cases. So we're talking about case management, we're talking about prevention, we're talking about supporting the water and sanitation, hygiene, we're talking about all the other logistical things, we're talking about production of consumables and drugs and vaccines to cope. So it's hard, but we're just about keeping our head above water.
Okay, I just hope that we'll be able to contain this pandemic.
We will, but people do have to take responsibility themselves as well.
Okay. Now, Lagos State has maintained, you know, its position as the epicenter of the virus. What other steps should be taken? We know about the non-pharmaceutical steps and, of course, the vaccination and all of that. What other steps do you think we can, you know, embrace to reduce, because this third wave, the figures are increasing by the day?
To be honest with you, when you say what more steps can we take, who is the we? Are you talking about on the basis of, are you talking about we, the Lagos State government, or we, the people? Because the government is implementing everything that is scientifically been proven to be of benefit.
Yeah, okay.
But like I keep saying, you can lead a horse to water.
You can't force
you
it to
can't
drink.
force it to drink.
Definitely.
At the end of the day, the people also have to want to look after themselves. So the people have to want to mask up, hand wash, space out. Because this virus, it doesn't really matter who's in government, it doesn't matter the color of your skin, it doesn't obey borders, it is no respecter of person or age.
All right, that should, I wonder why the way people are dying because of this virus or related to the virus, to COVID-19, we are still not eager to embrace inoculation.
I think that is pretty much, I'd like to think that's changing. We've done, there have been quite a few pieces of research that has been done locally about this issue of vaccine hesitancy, and a lot of it boiled down to the fact that people didn't really understand. So once you take the time and the effort to listen to their concerns and explain them, most and generally we find that the uptake is quite good. I know when the first batch of vaccines came, I mean, we mopped up everything. And Nigeria actually got an award that we had little or no wastage of vaccines. So every vaccine did get into an arm, or almost every vaccine got into arms. So I think what is important is that as health professionals, we listen to people's concerns and anxieties and take the time to explain. You know, without the background of science education, sometimes it just takes a little bit longer and you have to explain to everybody. But once we do, we find that the uptake is quite good.
Dr. Alero, we know the social media has a lot of influence on people. Now we have seen videos of people saying when they took the vaccine, they put a light bulb there and it came on. And that is really, really preventing I know a lot of people who have come to say, all those things those guys are saying is true. Me, I won't take it.
How do I put this politely? If you're running a fever, or you're having diarrhea and vomiting, and you need a doctor, I suppose it's social media you're going to go to?
No, not
exactly.
Okay.
So at the end of the day, if you're really concerned about your health and your well-being, you will take the advice of health professionals.
Okay.
you will not take the advice of Mr. and Mrs. Social Media.
Okay.
That's fine for parties and jokes and whatnot. But when you're really in trouble, you will find that 100% of people will look for a properly accredited and qualified health professional.
Okay, now, I hope Nigerians are actually, listening to Dr. Alero Roberts concerning the social media
infodemic.
Exactly, thanks for the word.
It is an infodemic.
Yeah. Okay, now, how readily available would you say the vaccines are at the designated primary health centers?
We haven't quite got, the Moderna has just arrived in country, but it requires a far stricter, more robust cold chain system.
Okay.
So I think they should be in Lagos, I think later this week or early next week. I cannot be certain of that. But what needs to be put in place is the cold chain logistics. Once the cold chain logistics are in place, then the Moderna vaccine will be available at pretty much all the primary health care, all the 57-page.
The designated.
Yeah, the designated health centers.
All right.
Yes.
Now, what are the likely consequences of taking the two vaccines available at the moment, if any?
Not a good idea, because you will not get the robust immunity that you need to get to withstand these variants that are coming out. So if you've started with the AstraZeneca, please wait. More AstraZeneca is coming. Right. If you have not started anything at all, then you can go for the Moderna. But you're going to have to take the 2 doses of Moderna. You can't take Moderna this week and go and take AstraZeneca next week. No, that won't work. And what doesn't work is in your body. It just won't build up the immunity that you need to protect you.
Now, thank you, Dr. Alero Roberts, for coming on Panorama today. Moving on now, former Deputy President of the Senate, Nasir Ibrahim Mantu, has died at the age of 74. The prominent politician was said to have died this Tuesday morning. He is to be buried at Gudu Cemetery after funeral prayers at Apple Zone D, National Assembly Quarters Mosque. Buhari mourns Ibrahim Mantu. Meanwhile, the president condoles with the family of former Deputy Senate President Ibrahim Mantu, joining the government and people of Plateau State in mourning the passing of the renowned politician. President Buhari commiserates with leaders and members of the National Assembly, friends and political associates of the former Deputy Senate President, who dedicated most of his life serving his people. The president prays for the repose of the soul of the departed, believing his legacy of reconciliation and promotion of peaceful coexistence will always be remembered, especially in bringing more harmony in the state and the country at large. And that's Panorama. Came to you live from the Lagos Network Center of the Nigerian Television Authority. I am Adeola Komiakere. Enjoy the rest of your day.